See what it is there? Do you see what it shows there? It says 223, and do you know what it is? This is the watch that one of my patients was wearing the other day in my office. She is a type 1 diabetic in her mid-30s, and that is a blood sugar. But guess what? It's not her blood sugar. You want to know whose it is? It's her daughter's. Well, then how is that happening? Well, her daughter has a relatively new device where the sensor will tell her cell phone what the blood sugar is. It will then send it to a website, and then she can then access it. So, you know, I take care of only people with diabetes, and there's nothing like having if your child has diabetes, that occupies you a lot. And if you've ever been in the room of parents of children with type 1 diabetes, it's an experience to hear some of the anguish they go through and the worries that they have. Well, when you see the application of exciting technology like this, where I'm at work and I can know that my child is okay because it's showing up, isn't that fantastic? That is just neat. I don't know how else to put it. Stop and think a second. There are any number of ways that these devices can malfunction, correct? Well, the people that are developing them, they are very smart engineers developing them. And guess what? And that same question, I was at a recent conference on that, and they thought of every problem that can possibly occur and two more than I could think of for every time I could think of a malfunction. In fact, with one of the systems, one of the closed loop systems, what they did is they introduced error into the system. In other words, they made the sensor tell the pump crazy data. And then they tested to see if the algorithm that the pump was using to decide how much insulin to give would obey it. And it didn't. But there are different groups that are working on it. Fascinating stuff. They actually have so many, there's redundancies in the systems. The sensor is telling you what the blood sugar is, and your blood sugar is going up and down during the day. Well, how does that pump know what to do? Here's how it knows. Prior to you starting the insulin pump therapy with the sensor, it compiled a library. Well, that library has thousands of data points. Those data points were fed into an algorithm. There are basically three types of algorithms investigators are using. Well, that algorithm then tells the pump what to do. So your first question was, there are great concerns. Look, a concern that people should worry about is, do other things interfere? If I'm using my sensor, let's suppose I'm using my sensor and I had a bad headache. Say I've been in the office all day long and I've been trying to use my electronic health record and my head is pounding and I'm using a sensor and I'm taking 1 gram of acetaminophen. Know what happens to my sensor? It gives me a value that might be as much as 50 or 60 milligrams off. So my taking acetaminophen, common Tylenol, will tell my pump, and it'll be all that. And there are several other things that will interfere with it as well. One of the companies has a glucose sensor. And what it is, it's a sensor that's about this big, maybe the size of a quarter, a little bit larger, and I guess maybe 1/4 of an inch thick. You pop it underneath the skin. It can sense your blood glucose. You then have a receiver that you sort of wave over it, and it'll tell you the blood sugar. Now that system I'm not even sure that it's approved in Europe yet, and I know, but they've applied for approval by the European Union, whatever I can't think of the name of their organization. And they're applying to our FDA. So you can know now that's a different thing. Now you can also know instantaneously. The one I showed you before, that's a real-time glucose sensor.